Hello loves, welcome back to my channel. If you guys are new here, I do nursing videos and my lifestyle as a new mom. Okay, so today's video is something I really wanted to talk about because I know it's something that is very scary to a lot of nursing students, and that is clinicals. Clinicals can be so intimidating, and I just remember when I was in school being so scared, like thinking I was gonna just fail, and I don't know, I was just super scared, and I just remember being so nervous and having so much anxiety surrounding the thoughts of clinicals. So today I just wanted to kind of give you some tips on how you can be prepared and how you can do really good. And so first thing you want to do is you definitely want to show up on time. If your school is anything like mine, they had a set out list of things that they would grade you on, and attendance was one of them. So that is something that you easily have control over. So you need to make sure that you get there on time so you can get all your points just for that. And yeah, that's basically it. Just show up on time. Okay, the next thing that you can do is have a positive attitude. I know clinicals are very scary, and also when you get there, sometimes it may feel a little intimidating because some of the nurses may look a little standoffish. They may look like they don't want to be bothered, but that's not always the case. Sometimes it may just be how they look. Still be friendly, be positive, and ask questions and get to know the staff. The more, if those people, if you leave clinicals with people knowing your name, then you've done a good job. All right, so you definitely want to have some type of resource that you can quickly look at diseases and how they present. So what I used was the F.A. Davis Patho flashcards. Basically, these cards have like all of basically every disease that you could think of, and basically they have on the front the clinical findings, and on the back they have what you would see in assessment, some of the complications, and the treatments for the disease. So these were very, very helpful, and I will include a link for these down below in the description box. Another thing that I know some of my classmates would use is the Tabor's medical dictionary or medical encyclopedia. You basically want to have some type of resource that if you are dealing with a patient who has a disease that you are unfamiliar with, that you could quickly look it up, because I know at my school you could not use your cell phone. You couldn't just whip out your cell phone and Google. So you definitely are going to need some type of resource that you can pull from to help you better understand certain diseases and the disease process. Okay, so number 3 is going to be willing to help and jump in. So if you're at clinicals and you see something that you know is wrong, like something that you have learned and you know that it's not right, like say if you see somebody on a feeding tube but their head is flat, you need to say something. You can step in and say, hey, isn't this person's head supposed to be elevated? You know, that is your job basically at clinicals, is to practice your nursing skills. So, and one of those nursing skills is assessment. So if you see something and you notice it, don't be afraid to speak up, because that is not going to do anything but impress your preceptor or whoever it is that's working with you. All right, so the next thing you want to do is make sure that you communicate with your preceptor. Keep in mind that your preceptor is there to help you understand anything that you cannot understand. Do not be embarrassed. No question is a dumb question. You are in a new setting and you will see a lot of things that you've never seen before, or some things that will confuse you. So if your preceptor is not with you at the time, make sure you write it down so you can ask them. But any little thing that you have a question about, just ask them, because their insights and their education is the reason that they are there precepting you. So do not be afraid. Okay, so the night before you go to clinicals, you want to make sure that you brush up on your assessment skills, because a lot of schools, when you go to clinicals, they are basically looking to see, you know, how well you can assess, your time management, things like that. They don't expect you to be perfect or anything, but that is basically some of the things that you do in clinicals. So make sure that you go over your like things that you need to know for the physical assessment of patients, and just be on the lookout for things that you can bring up. All right, so this next one is really very important. It's something that I experienced myself when I was in school. Do not ever do something that you are not comfortable doing. Now, they may pair you up with a nurse on the floor, or I don't know, they may pair you up with somebody who you're not used to, and sometimes these people think that you are there to do their work for them or help them do their work instead of teaching you like they're supposed to do. So if anybody asks you to do anything that you are not comfortable doing, do not do it, okay? And you can report to your teacher or whoever you are there with and let them know that you are not comfortable doing that and why you didn't do it. Don't be disrespectful about it or anything, but just politely tell them, hey, I'm not comfortable doing that, so no, I can't do it. Another important thing you want to do is get involved with the staff. Like, go around talking to different staff members, find out the ins and outs of their day-to-days. I mean, you don't want to aggravate people, but just pick their brain a little bit and, you know, get an inside look at how their day goes. And yeah, just be friendly, be open, talk to people. And this is not a situation where you want to be like that shy person. You want to get the most of this experience because it's probably gonna be the last real life experience before you actually get out into the real world and begin nursing. So you want to soak up as much information as you possibly can.